Patient voice is the most crucial factor to improving services.
We need to reach out to diverse communities. It's one of the challenges of the age.
And in order to design the best healthcare system for everybody, we need to know what people think and we need to know what's important to people.
Today's been a really busy day. We've brought together almost 200 people who were involved as partners with NHS England, with clinical commissioning groups, with sustainable transformation partnerships and other health organisations, as volunteers, as people with experience, as people who have knowledge and compassion about how we need to shift the dial on how the NHS works with people as partners rather than just seeing them as consumers of healthcare.
I think it's really valuable to have days like this. I think that it brings together people from all sorts of different backgrounds, from all different parts of the country, with all different perspectives and all different experiences of how the NHS is changing. And we can share those experiences, people can learn from one another, build networks, build relationships.
Patient voice is the most crucial factor to improving services. Without patients and indeed members of the public who aren't patients at the moment, we are not meeting the needs of our population. It's there for all of us, and it's vital that we as the public have that level of transparency, I suppose.
Patients bring a different voice to the discussion. The NHS is complicated, it's constantly changing. There is a tendency when clinicians and managers are in a room to focus about systems and processes and structures, even for people who are really heavily motivated by the patient experience. And it's really crucial that when you've got a patient in the room, the conversations are really about what matters most, what benefits the patient, what benefits the carer, and how the structures and processes need to support that rather than dominate the discussion.
We need to reach out to diverse communities. It's one of the challenges of the age. It's not just reaching out, it's listening. We have a society that doesn't look like it did 20 years ago. Well, it doesn't look like it did when the NHS was started, and that's a good thing. Many of those people have contributed to the NHS, yet we don't see representation of BME and minority groups in the leadership of the NHS, and we don't see them represented as fully as they should be in the patient and citizen voice.
By looking here and there and by talking to different people, I was presenting this opportunity to join, to raise a voice at the right place. And having these NHS staff, directors there, who can listen my views and taking them into account, for me was meaningful. Really, I can't even put a price on that.
Since I've become a PPV partner, I've done work in improving the health care of patients in the justice system. I've also done work in the IRCs, the immigration centres. I've seen patients get involved with forums and have a real interest in their own healthcare and healthcare for others.
So people can still join their local NHS in all of the usual ways, by joining their patient reference group at their local GP, by joining their hospital trust as a member governor, by joining a CCG as a lay member. All of those things are valid.
I would encourage people to get involved to be a PPV partner. It's very rewarding work. The responsibility I have motivates me and gives me the opportunity to make real change.
By experience, I think that to reach the diverse group is to meet them where they are. We have a work to do with them as partners. So it's up to us to go and listen to them, meet them, build a relationship with them where they are. You can learn so much just by listening to them.